If you're still dealing with concussion symptoms weeks or months after your injury, you might be wondering, why am I not better yet? Does this mean something is permanently wrong? Why do I feel okay one day and then completely wiped out the next? And honestly, that can be incredibly frustrating, especially if you were told to rest, wait it out, and things would eventually go back to normal. But here's the encouraging part. Lingering concussion symptoms do not automatically mean permanent brain damage, and they do not mean recovery is impossible. In many cases, symptoms continue because one or more pieces of the recovery puzzle have not been identified or treated yet. So today, we're going to talk about why post-concussion symptoms can linger, why symptoms can come and go, what systems may be involved, and what you can start doing to move your recovery in the right direction. One of the biggest misunderstandings about post-concussion syndrome is the idea that all lingering symptoms are coming directly from the brain injury itself. Now, a concussion does affect the brain, but after the early phase of recovery, ongoing symptoms are often more complicated than just the brain hasn't healed yet. Instead, persistent symptoms can involve several body systems working together. So, for example, dizziness might be related to the inner ear system, the neck, the visual system, blood pressure regulation, anxiety, fatigue, or a combination of all those. Headaches might be coming from the neck, migraine-like changes, eye strain, exertion intolerance, stress, poor sleep, or sensitivity to busy environments. This is where two people can both have post-concussion syndrome, but need completely different treatment plans. And it's also why a one-size-fits-all approach often falls short. A concussion can temporarily disrupt how the brain and body regulate information. That may include how your brain processes movement, light, sound, visual motion, balance, heart rate, neck input, and even stress. Early on, rest can be very helpful. You may need to reduce your activity, limit symptom spikes, and give your nervous system time to calm down. But complete rest for too long does not solve the problem. In fact, modern concussion recovery often involves a gradual return to activity and active rehabilitation, starting at just 2 to 3 days post-injury in many cases. That does not mean pushing through severe symptoms. It means finding the right starting point, then slowly building tolerance over time. Think of it like recovering from an ankle injury. You might rest at first, but eventually you need to restore strength, balance, mobility, and confidence with movement. Concussion recovery can be similar. The brain and body often need guided exposure back to the things that are currently difficult. Let's walk through some of the common systems that can contribute to lingering concussion symptoms. The first is the vestibular system. This is your inner ear and balance system. It helps your brain understand motion, head movement, and where your body is in space. If this system is irritated or not working well, you might feel dizzy, off balance, nauseous, or uncomfortable in busy places. This is one reason grocery stores, crowds, scrolling on your phone, or walking through visually complex environments can feel overwhelming. Your brain is trying to process a lot of motion and visual information all at once, and the system may not be ready for that. The second system is the neck. The neck is commonly involved after a concussion, especially if the injury included a whiplash, a fall, a sports collision, or a car accident. Neck issues can contribute to headaches, dizziness, head pressure, visual discomfort, and symptoms that worsen with posture and head movement. Sometimes people focus only on the concussion and miss the fact that the neck is still sending irritating signals into the system. Third area is the visual system. After concussion, some people have difficulty with eye tracking, focusing, depth perception, or coordinating both eyes together. This can make screens, reading, driving, school, and computer work, and busy visual environments much harder. You might notice eye strain, frontal headaches, fatigue, dizziness, blurred vision, or the feeling that your brain shuts down after visual tasks. The fourth system is the autonomic nervous system. This system helps regulate things like heart rate, blood pressure, temperature, digestion, and your fight or flight response. After a concussion, some people develop symptoms when they stand up, they move around, exercise, or try to do too much too soon. You might feel lightheaded, shaky, nauseous, anxious, foggy, or unusually fatigued. This is one reason exercise intolerance can happen after a concussion. It's not always because you're out of shape. Sometimes your nervous system is having trouble regulating the demands of the activity. Fifth area is headache and migraine-related symptoms. Some people develop headache patterns after a concussion that behave a lot like migraine. That can include light sensitivity, sound sensitivity, nausea, dizziness, visual sensitivity, fatigue, and headaches that worsen with stress, poor sleep, certain foods, hormonal changes, or too much activity. And finally, there's the role of sleep, stress, and daily routine. These are not just lifestyle factors, they can strongly influence how sensitive your nervous system is. Poor sleep, inconsistent meals, dehydration, high stress, and unpredictable routines can make symptoms more reactive. That does not mean your symptoms are imaginary. It means your brain and body may be operating with a lower threshold. And these factors can affect how much your system can tolerate. One common mistake is waiting too long and hoping symptoms will disappear on their own. Some people absolutely do improve with time, but if symptoms are continuing for months, it may be a sign that something specific needs to be addressed. Another mistake is resting completely for too long. Rest is useful early on, but prolonged avoidance can make your system less tolerant of normal activity. Over time, things like walking, screens, exercise, stores, or social situations may feel harder because your brain and body have not been gradually reintroduced to them. Now, another mistake is trying to push through everything. This is the opposite extreme. If every day becomes a cycle of overdoing it, crashing, resting, and repeating, your nervous system may stay irritated. The goal is not complete rest, and it's not aggressive pushing. The goal is to find the right level of challenge. Another mistake is assuming that all symptoms have one cause. For example, dizziness may not be just vestibular, headaches may not be just the neck, fatigue may not just be poor sleep. Symptoms often overlap. That is why individual assessment matters so much. The key question is not just, what symptoms do I have? The better question is, what is driving these symptoms? In my experience, it's very rare that someone has no potential for meaningful improvement. That does not mean every recovery is easy or fast. Some cases are complex. Some people have multiple systems involved. Some people have been dealing with symptoms for a long time. but persistent symptoms often happen because one piece of the recovery puzzle has been missed, undertreated, or misunderstood. For example, someone may have been told that they just need more rest when they actually need vestibular rehab. Someone else may be doing eye exercises, but their neck is still a major driver of headaches and dizziness. Another person may be trying to exercise, but they are starting at an intensity that is too high for their autonomic system. And someone else may be working hard on rehab, but poor sleep and stress are keeping their symptoms highly reactive. This is why concussion recovery often needs a systems-based approach. You want to understand the role of the vestibular system, neck, vision, exercise intolerance, headaches, sleep, stress, and daily activity patterns. Once you understand which systems are involved, recovery becomes much more targeted. And targeted recovery is usually much more effective than guessing. So what can you start doing first? Begin identifying your symptom triggers. Pay attention to what worsens your symptoms. Is it screens, busy stores, driving, reading, exercise, stress, poor sleep, neck movement, standing up quickly? Write these patterns down, not because you need to avoid everything forever, but because patterns give you clues about which systems may be involved. Second, gradually reintroduce light movement. For many people, gentle walking is a good starting point. The key is to start at a level you can tolerate and build slowly. You do not need to prove toughness by pushing into a major symptom flare. A helpful approach is to find the amount of activity that creates little to no symptom increase, then gradually progress from there. Third, focus on your daily foundation. Sleep, hydration, nutrition, stress management, and routine structure matter. Again, these are not magic fixes, but they can help lower the sensitivity of your system and make rehab more effective. Fourth, avoid comparing your recovery timeline to someone else's. This is really important. One person may recover in 2 weeks. Another person may take months. Another person may need targeted treatment because multiple systems are involved. Your timeline does not mean you are failing. It means your recovery needs to match what your body and brain actually need. And fifth, consider getting an individualized assessment. If you've been stuck for a while, it might be incredibly helpful to work with someone who understands concussion, vestibular issues, headache, neck involvement, visual symptoms, and exertion intolerance. The goal is to figure out what is actually driving your symptoms, so your plan is specific to you. If you are still having symptoms months after a concussion, I know it can feel discouraging, but lingering symptoms do not mean you are broken. They do not mean your brain is permanently damaged, and they do not mean you are out of options. Many people continue having symptoms because the right systems have not been identified yet. Once you understand the different pieces that can contribute to concussion symptoms, recovery often starts to make a lot more sense. The path forward is usually not one magic exercise, one supplement, or one simple trick. It is understanding your symptom pattern, identifying the systems involved, and gradually rebuilding tolerance in a way your body can handle. Recovery is often possible. Improvement is often possible, and you do not have to figure it out by guessing. If you're frustrated by lingering concussion symptoms and you're not sure why recovery still feels stalled, download the free guide to 6 concussion subtypes. It will help you better understand the different systems that may contribute to dizziness, headaches, fatigue, visual sensitivity, exercise intolerance, and other persistent symptoms after concussion. And if you want a more guided step-by-step approach, You can also explore the Brain Recovery Project Concussion Recovery course, which is designed to simplify the recovery process and help you create a more individualized path toward improving symptoms and returning to normal activities. Links to both the free download and information on the concussion recovery course are in the video description below. Thanks for watching, and I'll see you in the next video.